Hello, I'm Pat O'Leary. I'm a pediatric cardiologist at the Mayo Clinic and a member of our Congenital Heart Disease Center. It is our role here at the Mayo Clinic to care for all patients, from the fetus to the adult, who are afflicted with congenital cardiac malformations. And with me today is Dr. Tim Nelson, the director of our Regenerative Medicine Research Program at Mayo. Tim and I are going to discuss how our integrated approach to the care and investigation of potential new therapies in congenital heart disease may lead to new therapies that will help prolong the functional status of patients born with abnormal hearts. Tim, it's good to have you with me today.
Thank you.
Our relationship is a little bit different than the average clinical cardiologist and researcher, don't you think? Could you tell us how it came into being?
I think it's really unique at Mayo Clinic is the needs of the patient coming first, and it really drives the unmet need of what congenital heart disease has focused on. And my role in regenerative medicine and as a stem cell biologist is emerging into a new exciting area of being able to bring that technology to bear to pediatric or congenital heart diseases of many kinds. And so our program of the Todd and Karen Wanick program for hypoplastic left heart has really been the stimulus that brings together a cross-functional team of people to tackle some of the biggest challenges that we're facing in congenital heart disease today.
What would you describe those challenges as being?
So the dream for the research in stem cells and regenerative medicine today is to rebuild tissues and to be able to make weak tissue stronger. And as you know in the cardiology world, that a weak heart muscle is a major problem. And as in stem cell world, we have new technology that we can actually rebuild and strengthen the heart. So the opportunity is to use this technology and innovate and drive new therapies into the clinic that are based on new technologies such as stem cells. And so that's really has the potential of transforming the way you take care of your patients in the clinic with this new technology.
That's fascinating. How would we go about doing that?
So the way we've approached it thus far is in our research program here in the regenerative medicine is using umbilical cord blood right now as our starting material, where we can diagnose these children in utero, collect the umbilical cord blood, process it, and during their routine standard surgeries that these children are forced to have, we can add these stem cells as an add-on to try to make their heart bigger, better, and stronger. This is the first FDA monitored study that we're doing right now with umbilical cord blood and hypoplastic left heart, but it's the start of much bigger things of where we can bring it to other children that are older, that may not have umbilical cord blood or have other diseases beyond hypoplastic left heart.
How would you expand that? What other, if you don't have cord blood available, what other strategies are there to get a cell therapy for a patient?
So the other easily attainable cell source is bone marrow, and we can virtually collect bone marrow from anybody. This has been used for 10 years or more in the adult world of heart disease, and using bone marrow may be the next source of cells that we could use to repurpose to make the right heart bigger, better, and stronger. And so for virtually anybody with a failing right ventricle of a Fontan circulation, this technology may become available in the near future as we repurpose it.
That's great, Tim. I think that our conversation here today has shown, or at least highlighted, some of the benefits of the collaborative nature of our practice here at Mayo. And in very, very few situations do you find someone with Dr. Nelson's background and in my background working as closely together as possible. Hopefully that integrative and innovative approach will allow us to bring this kind of new therapy for regenerating muscle function to a very broad group of patients with congenital heart disease in the not too distant future. We're starting with patients who have failing single ventricles, but we hope to expand that focus into those with biventricular circulation such as Ebstein's anomaly and other right heart disorders so that the muscle function can be improved in these patients who face a very challenging future if that is not possible. Tim, I want to thank you for being with us today, and we look forward to additional discovery and innovation as we move forward into the future.
Thank you.